Varicose veins is a situation in which the veins are keratinized and dilated. It is possible that varicose veins appear in all veins in the body, but they mostly affect the veins of the legs. This is because walking and standing for a long time increases the pressure on the veins of the lower body. For many people, varicose veins, which is a diffuse and mild type of varicose veins, is a matter of only a cosmetic problem. For others, it is possible that varicose veins can cause very severe aches and discomfort, and it is possible that varicose veins sometimes lead to more severe and serious complications and problems. In some cases, they pose a risk of developing other diseases related to blood flow in the body. Symptoms of varicose veins. One of the symptoms of varicose veins is veins that look twisted and swollen, as if they are ropes on the legs. Most often, varicose veins do not cause pain at all. One of the symptoms of varicose veins is the following: veins in blue or purple. The veins look twisted and swollen, as if they are ropes on the legs. Varicose veins may appear in different places of the legs, from the groin to the ankle, and with the appearance of painful signs and symptoms. They may include the following: feeling of pain or heaviness in the legs, burning, palpitations, muscle spasm, swelling of the lower legs, increased pain after prolonged sitting or standing, itching around one or more veins. Sores on the skin near the ankle can symbolize the presence of a serious vascular disease that requires medical treatment. Spider veins are a condition similar to varicose veins, but smaller where they are closer to the skin, usually red or blue. They usually appear on the legs, but they may also appear on the face. They appear in different sizes in different people and often look like a cobweb. Causes and risk factors of varicose veins. The risk of varicose veins increases with age, as the arteries carry blood from the heart to various other tissues in the body, and the veins return blood from different parts of the body to the heart. In order to return blood to the heart, the veins of the legs should work against the force of gravity and the force of attraction. Contractions in the muscles of the lower leg act like pumps. The soft walls in the veins help the blood to return to the heart, and the small valves in the veins open when the blood flows towards the heart and then close to prevent the blood from flowing back. Common causes of varicose veins. They include the following: 1. Age. As a person gets older, the veins lose their softness, which makes them expand, and the valves in the veins may become weaker, which allows the blood that should flow to the heart to turn back, and so the blood collects in the veins, which leads to their dilation, and varicose veins are formed. Varicose veins appear blue in color because they contain blood that lacks oxygen. 2. Pregnancy. Varicose veins form in some pregnant women, as pregnancy increases the volume of blood in the body, but reduces its flow from the legs to the pelvis. This change in blood circulation aims to support the fetus, but may nevertheless cause an unfortunate side effect of widening the veins of the legs. Varicose veins may appear for the first time, or may worsen late in pregnancy when the uterus puts more pressure on the veins in the legs, and hormonal changes during pregnancy may also play a role in this. Varicose veins that appear during pregnancy usually improve without the need for any medical treatment within 3 months after delivery. Factors that increase the risk of infection. They include the following: 1. Age. Varicose veins often appear at the age of 30-70 years, and the risk of developing them increases with age, as aging causes erosion and rupture of valves in the veins that help regulate blood flow. Eventually, the wear of the valves causes the blood to be able to flow back into the veins, where it collects instead of flowing to the heart. 2. Gender. Women are more prone to varicose veins than men. Hormonal changes during pregnancy, in the premenstrual period, and in the menopausal period can be provoking factors for this. Female hormones tend to cause loosening of the vein walls, and taking hormone replacement or birth control pills may increase the risk of varicose veins. 3. Genetic factors. The likelihood of varicose veins increases in those whose relatives suffer from them. 4. Excess obesity. Excess weight is an additional strain on the veins. 5. Prolonged standing blood flow is less efficient when staying in the same position for a long time. Complications of varicose veins. Complications of varicose veins are rare, but they can include ulcers, blood clots. Diagnosis of varicose veins. To diagnose varicose veins, the doctor conducts a physical examination, which also includes observing the legs in a standing state to notice if there is swelling, and sometimes the doctor may also ask to describe what the aches in the legs are. In some cases, an ultrasound examination may be required, which can be used to check whether the valves in the veins are working normally, or if there is any evidence of thrombosis. When this examination is performed by the following steps, you should lie down on the bed. A small amount of warm gel is applied to the skin. With the help of the gel, it prevents the formation of air pockets between the adapter and the patient's body. A skilled ultrasound technologist places a small hand tool called a transducer in the area being examined and moves from one area to another if necessary. The adapter transmits the image of the veins in the legs to a monitor that the technologist and the doctor can watch. Treatment of varicose veins. Treatment of varicose veins may be limited to methods and means of self-treatment, or it may need procedures performed by a doctor to block or remove veins. The treatments include the following. 1. Playing sports. Exercise can relieve pain and prevent varicose veins from worsening. Fortunately, varicose veins treatment usually does not require hospitalization or a long and uncomfortable recovery period. 2. Self-care. Self-care can relieve pain and prevent exacerbation of varicose veins, including weight reduction. Avoid wearing tight clothing. Raise the legs. Avoid standing or sitting for long periods. 3. The use of rubber socks. Wearing rubber socks is often the first step before any other treatment, and these socks are worn all day so that they are wrapped around the leg and put pressure on it, which helps to push the blood in the veins and muscles of the legs more efficiently. The degree of compression varies depending on the type of socks and brand. There are socks of different colors, and with different degrees of compression. There are many types of rubber socks on the market, so everyone can find comfortable and suitable socks for him. When buying rubber socks, you should make sure that they fit the leg. The patient or pharmacist can measure the leg with a measuring tape to ensure that you buy socks of the right size. Rubber socks should be strong, but not tight and tight. Perhaps those who suffer from weak hands or from arthritis will find it difficult to wear such socks. In turn, there are special devices that help with socks. 4. Other treatments. If self-care and rubber stockings have not helped to cure varicose veins, or if the condition is more serious, your doctor may recommend one of the following treatments. Treatment of varicose veins with sclerotherapy, laser surgery, surgery using a catheter, hide the veins, prevention of varicose veins. There is no way to completely prevent varicose veins. However, improving blood circulation and tightening muscles may reduce the risk of varicose veins, and home measures that help alleviate the discomfort caused by the formation of varicose veins may also help prevent their appearance. They include the following: aerobic exercise, maintain a healthy weight, maintain a diet high in fiber and low in salt, avoid high-heeled shoes, tights, and tight underwear, raise the legs, change the sitting or standing position at a fast pace. Alternative treatments. Aesculus. Herbs that can help in treatment include the following: witch hazel, calendula, horse chestnut, butcher's broom, grape seeds, berries,